Premature atrial contraction, a single electrical impulse that originates outside the SA node in the atria. This individual complex arises earlier than the next expected complex of the underlying rhythm or prematurely. Quite often, a PAC will occur in an underlying sinus rhythm that may appear regular and within normal limits, except for the presence of the PAC. Simply stated, a premature beat is a complex that arises earlier than the next expected beat. Normally, we expect the QRS of a PAC to be of normal size, shape, and duration. An incomplete or non-compensatory pause often follows a PAC. This occurs because a PAC will usually cause the SA node to depolarize prematurely and will thus reset the SA node. Supraventricular tachycardia. First, look at your patient, treat the patient, not the monitor. The term paroxysmal refers to the sudden onset or cessation or both. In order to label a rhythm correctly as paroxysmal, it is critical that the sudden onset or cessation be observed on the cardiac monitor. Only then, in the strictest sense, can the rhythm be correctly identified as paroxysmal in nature. Typically, bouts of PSVT begins and end abruptly. Notably, these bouts may continue for several hours or for only a few seconds. Atrial fibrillation is one of the most common atrial dysrhythmias encountered in elderly patients. Typically, atrial fibrillation presents with three definite characteristics. First, there is a notable absence of P waves in this rhythm. Second, P waves are replaced by F waves, or fibrillatory waves. Third, possibly the most obvious characteristic of atrial fibrillation is that the ventricular response rate is totally irregular. It is called an irregular irregularity. The QRS complexes in an atrial fibrillation rhythm are usually within normal limits. When multiple disorganized ectopic atrial foci generate electrical activity at a very rapid rate, about 350 to 750 beats per minute, atrial fibrillation results. The ventricular response rate is 140 to 200 beats per minute in the untreated atrial fibrillation rhythm. Atrial flutter is characterized by the presence of regular atrial activity with a picket fence or sawtooth pattern. When a single irritable site in the atria initiates many electrical impulses at a rapid rate, the rhythm is called atrial flutter. Normal P waves are not produced in atrial flutter because electrical impulses are conducted throughout the atria at a very rapid rate. Rather than presence of normally appearing P waves, flutter or sawtooth waves, also known as F waves, are patterned. The AB node plays a very important role in atrial flutter rhythms. It truly becomes the gatekeeper to the ventricles. The ventricular response rate is based on the number of impulses that the AV node accepts. In other words, if every other flutter impulse is blocked by the AV node, the conduction ratio becomes 2 to 1. There will be 2 atrial contractions for each ventricular contraction. If the AV node conducts only one of every 4 atrial contractions, the conduction ratio is 4 to 1. Thus, an atrial rate of 300 beats per minute will parallel a ventricular rate of 75 beats per minute. Causes of atrial flutter include myocardial infarctions, hypoxia, digitalis toxicity, congestive heart failure, SA node disease, and pulmonary embolism. Atrial flutter may occur in patients with normal, healthy hearts, but it is most often seen in elderly patients with underlying chronic heart disease. Wandering atrial pacemaker may be considered variants of sinus dysrhythmia rhythms. The size and shape of the P waves varies according to the site of origin, and there is a notable change in morphology from beat to beat. P waves may appear as upright, inverted, or absent waveforms. The absence of P waves in this rhythm may indicate that the P wave is buried in the QRS complex. The PR interval may be regular but will sometimes vary on the basis of the point of origin. Causes of wandering atrial pacemaker vary. The rhythm may be a normal phenomenon, particularly in the ages or the very young, or the rhythm may be linked to underlying heart disease. At times, the rhythm may be simply a manifestation of the vagal effects of respirations. As with other rhythms, wandering atrial pacemaker may be a result of drug toxicity, especially with digitalis therapy. Generally, a wandering atrial pacemaker rhythm produces no symptoms and can be recognized only by EKG observation. Although this rhythm is usually benign, it is wise to remember that it may indicate myocardial irritability and thus may require treatment. The potential for this rhythm to progress to more serious dysrhythmias cannot be ignored.